Hi everybody, I am that nursing prof and welcome to my channel. In today's video, we're going to be talking about another essential nursing skill, self-care. And I know you might be thinking, wait, that's a skill? But it is a skill. Knowing how to take care of yourself as a nurse is just as important as knowing how to put in an IV or put in a catheter. It's something you need to learn and it's something you need to practice so you get better at. So it is an essential nursing skill. Our profession is a little bit special just because of the things that we experience and the things that we are exposed to compared to like other professions, right? We see a lot of tragic things, we hear a lot of horrible stories, and obviously that's going to affect us. We're not robots, we're people. So knowing how to take care of yourself so that that trauma doesn't affect you as much is really important. You've probably heard of nurses experiencing things like burnout, compassion fatigue, or even secondary trauma syndrome. So self-care is our tool, our skill that we're going to use to help us deal with those things. I wanted to quickly define those two things just in case we weren't familiar with the differences. So secondary traumatic stress or secondary trauma syndrome is emotional stress or distress that you as the nurse will feel as a result of hearing the patient's traumatic issues, okay? So hearing their firsthand account of the things that have happened to them, you experience emotional distress listening to that. And then compassion fatigue is where you gradually lose compassion over time because you're exposed to other people's stress and other people's trauma. And compassion fatigue manifests with like emotional and physical exhaustion. This is what we also call burnout. So if you've heard of burnout and compassion fatigue, that's what that is. It's emotional and physical exhaustion dealing with the trauma that others have experienced and taking that on. And then over time, you lose compassion and you lose empathy for others. And maybe you've seen this, maybe you've experienced this in your nursing career or even just as a patient. Sometimes you'll go into the unit and then there'll be a patient who's screaming in pain. And the nurses are just sitting there completely ignoring them. And you're like, oh my God, why are they ignoring them? These are terrible nurses. And then the nurses say, he does that. He does that all day, every single day for the past, 2 months. And they're just sick of it and they're over it. That is an example of compassion fatigue. So it's very important that we take the time to take care of ourselves too, because this is what leads to burnout. This is what leads to people quitting their jobs and giving up their careers as a nurse. Taking care of these patients and taking on their stress and taking on their burden. So I know self-care is kind of like a buzzword thing that people talk about, and usually we associate it with things like going to the spa, getting your nails done, Well, first of all, nurses aren't allowed to get our nails done, right? So that's not an option for us. But that's not what real self-care is. Self-care is whatever you need to do to take care of yourself physically, mentally, and emotionally. And that's going to be different for each person. Some examples of how you can practice self-care if this works for you, I would recommend setting boundaries. Know when to say no. Especially as a new grad nurse, this can be very challenging. I remember when I first started nursing as a new grad, I didn't delegate anything. I did everything myself, everything. Vitals, blood sugars, emptying Foleys, things like that. And it's not that I didn't trust, the PCTs and things like that. It was just I felt so responsible for everything, which you are, right? You're accountable for everything at the end of the day. And that's why I felt like I had to do all of it myself. But guess what? That was really stressful, right? So asking for help, setting boundaries, these are things that you can do that's going to help you kind of minimize your stress at work, and that way you're less likely to bring that stress home with you. Another thing I would recommend is taking a mental health day. And that means whatever it means to you. So if that's just staying at home all day and watching Netflix, if that's going to a spa, if that's going to a theme park, whatever it is, take that day to yourself when you need it. Plan that into your schedule. when you know you're going to be working a lot. This is another thing nurses do that doesn't help with the problem, is they schedule themselves like 3 in a row or sometimes 5 in a row. That way you get your weekend off and then things like that. So you mess with your schedule that way. That's not healthy for you mentally or physically, right? It's hard to be around that and to do this job day after day after day without taking breaks, without taking good mental health days. I know several nurses that work multiple jobs and they actually never get a day off, because when they're off on this job, then they work job B, right? And it's back and forth. I know people who work a day job and then they go work a night job, right? So that's not good. That's not healthy for you physically, mentally, or emotionally. So making sure that you are taking mental health days, you are taking breaks, you are taking days off, you are taking a day to do nothing, right? Sit around and relax and do whatever you need to do to kind of get yourself to refocus. That's really important for you. You want to be assertive. And I know some people think assertive, like aggressive, like I'm going to be fighting with people. No. Assertive is just standing up for yourself, right? This is like I was talking about setting boundaries. Know when to say no. And don't feel guilty about saying no. That's another thing. I have a whole nother video about too shy to be a nurse. And in that video, I talk about how important it is to be assertive and to set those boundaries and to let people know your worth, right? This can happen in school. If you're taking on too big of a load, too big of a course load, and you're feeling stressed out about it, then drop a course, right? Go to part-time if you can. There's no shame in that. A lot of times people are embarrassed about that sort of stuff, and there's no reason to be. I have students come to me all the time saying, I'm taking this class, and it's more than I expected, and I didn't think I was going to be able to handle it, and I'm not doing well in either of my classes. What should I do? And then I always say, do you think it's possible for you to pass both these classes? If the answer is no, drop the one you're not doing as well in. And there's no shame in that, and that's okay. And then as a nurse, it's the same concept. If you are being asked to do more than you should, if you're being asked to come in extra all the time, it's okay to say no. Set those boundaries and protect yourself. It's okay to do. And it's not insulting the other person, and you're not being rude to the other person by saying no. It's okay to set limits and set boundaries with other people. The last thing I wanted to talk about is, how do I say no? How do I be assertive? Because it's all well and good for me to be like, you should be assertive. And then in the real world, you're like, I don't know what to do. What do I do? Right? So these are my pointers on how to do that. First of all, say the actual word no. No, I can't do that. That way, it's very obvious what you want. You're not being vague. There's no ambiguity involved. You said the word no, and they know that. Keep your answer short, simple, to the point. Say, I can't do this because X, Y, Z. Be firm with your answers. Be direct. They don't need some big, long explanation about why you can and cannot do things. You are allowed to take care of yourself. If you are watching this video and you are waiting for somebody to give you permission, this is me giving you permission, okay? You are allowed to take care of yourself mentally, emotionally, and physically. That should be your priority. It's more important than your work. So if you need to take a mental health day, if you need to take a day off, or if you need to switch careers even, or switch the type of nurse that you are, you can't handle the field you're in and you want to do a different type of nursing, then do that. You are allowed to take care of yourself and do the things that you need to do to take care of yourself. And don't let anybody make you feel guilty into doing it and sticking around or doing things you don't want to do or doing things extra if it's not right for you, okay? You should do that stuff because you want to do that stuff. And if you don't, that's okay. And then the last thing I wanted to say about this related to the guilt is, don't say, oh no, I can't do it, I'm sorry because blah, blah. Okay, don't feel sorry. This is something I've personally had to work on. Anytime I'm asked to do extra things and I can't because I have other obligations, I have a family and stuff like that, I always, well, I'm sorry, I can't do it, I feel bad. Don't do that. Don't feel bad. Don't say I'm sorry. Say, no, I can't do it because X, Y, Z. Short, simple, firm, direct, assertive. That's a good thing. And it's something that takes practice. That's why I said it in the beginning of this video, that this is a skill and it takes practice and you need to get better at it over time. I know I'm a lot better at it than I was 15 years ago. So this is something that takes time and lots of practice, and I hope you all do really well at it. I hope this video was helpful. Thank you for watching. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.